staff person and I believe one of the community's janitors.
Yes.
Please
Sandra Diaz, who is the president of the Justice for Janitors at SEIU USWW here in San Diego. She is our lead. Our lead Justice for Janitors campaign has been, and justice across the country now for probably 2 decades, maybe more. But in San Diego, people of faith and conscience and electives have worked on justice for janitors since 1998. And in that time, have made some serious gains for people who work in a profession that is very, very much exploited. It happens often late at night. There's nobody too much to see what's going on. And so it's very easily to exploit a workforce that is not organized. The best thing about Justice for Janitors is janitors throughout San Diego County and the city of San Diego. There's 1,800 janitors who are represented by SEIU USWW. That means at the least of it that people in the industry that have terrible, terrible working conditions have a grievance procedure. So women can't have their schedules changed without somebody knowing about it. They have holidays and vacation days at the least. But every 3 years there is a contract negotiation, and I am so sad to tell you that you're going to hear about the paltry wages and benefits that janitors earn in San Diego, particularly those of San Diego who are working in what's called the suburbs. The suburbs is anything other than downtown San Diego. And so for about 12 years, the people of faith through the Interfaith Committee for Worker Justice have been engaged in supporting the Justice for Janitors campaign and the janitors, which means that we know janitors. We know the people because we've seen them. We've watched their children grow up. We've watched the people who come here and hope that their children can go to college and become lawyers and human relations commissioners. We've watched some of that happen already because we've known people for a long time. So the aspirations of the janitors and their campaign is very, very close to the heart of people of faith in San Diego, so much so that last week, if you open your folder, we did a Holy Week action where we washed feet of janitors. Marty Emerald, your city councilwoman, and David Alvarez, Councilman David Alvarez, were part of those who got on their knees and washed the feet of janitors. It was very, very touching to highlight the struggles that you're going to hear about in a moment. And then we made a pilgrimage throughout the UTC area where workers clean the cathedrals, the biotech, and in the city of San Diego, the cathedrals really to success, to our advanced civilization, the biotechs, and yet they work there without health insurance and meager wages that you're going to hear about in a moment. We made a few pictures for you because a picture does tell 1,000 words. And with us the whole time was City Councilwoman Marty Emerald and as well as David Alvarez, and they can witness their own experience if you would like to talk to them further about it. You have also with you a sheet that says confidential, which summarizes for you the aspirations, and Sandra's going to go over that with you, and then a more recent overview by SEIU that was passed out, and Sandra will go over that with you too. In addition, in your packet, and I'm glad you're sitting down, you will be very shocked to know that the best press we got for the foot washing event was through the Union Tribune. Really amazing, first time ever that our Union Tribune covered it, as well as there was, so that's on 2 pieces of press you should have here. It should be inside, yes, the Union Tribune. And the day before, and now you're going to giggle, the day before in the food section, there was a special presentation on Passover and Easter, and the writer contacted us because they knew that people of faith in San Diego, and this, by the way, was published in the Union Tribune, but it was published all over the country. It was picked up as a piece all over the country, that people in San Diego bring their faith traditions to the values and the lives and the aspirations of real people, and through our foot washing and through our delivering of the symbols of Passover to businesses that make their workers suffer. And so she wrote an article about Passover and Easter and talked about what we were going to do for the Holy Work supporting the janitors, and that went all over the country. So you have in the past, as a Human Relations Commission, been exceedingly supportive and understanding of the struggles of people who work. not only janitors, but also of your blue collar city workers. You have really taken a leadership stance. And at this point, in order to fulfill the aspirations that are modest of the janitors during these contract negotiations, it's going to take all of us to make the village that turns the light on to justice. And so I want Sandra to talk to you about what's going on. I want us to hear real stories about what happened so you can witness with your own eyes and ears. And then we want to talk to you about our ask for the Human Relations Commission. And we want to talk with you about that.
So good afternoon, and thank you for having us. And I wanted to thank Rabbi Lori for sharing the history of Justice for Janitors. And I want to go to what the struggle is now and what we're facing today. So just to lay out what the industry looks like and where our members clean, they're cleaning mostly commercial real estate and biotech firms and high-tech firms in the entire county, from San Isidro to Carlsbad. And within this region, you have some of the leading commercial real estate owners that we were able to show throughout bargaining, and have been able to talk to many people of how some of these leading commercial real estate companies have not only had gains, but have thrived during the past recession. We have companies such as that Irvine company that's growing and investing in San Diego, which we support. I'll talk our word of caution as we support all these projects as well. Kilroy, which is a leading commercial realtor also here in San Diego, which is also saying we're seeing growth, we're seeing opportunities in San Diego. The biotech firms are, San Diego is, I believe, the 7th largest biotech cluster in the country. Many of these biotech firms are starting to come into the city for different reasons. And one, because there's a concentration, the city has supported and fostered an environment where these biotech firms can grow. And we think that the prosperity is great. We've been able to show that some of these commercial real estate owners have millions and billions of dollars in assets, contrast with the reality of how our members live. So I wanted to kind of paint the picture of who the players are. And we think it's, what we've been telling a lot of these clients is, a lot of these leading figures in the industry is, we think it's great that you're prospering. But as you prosper, communities should prosper, flourish with you, and our members are an integral part of this community. They're not just janitors, they are mothers and fathers of families. And they go to churches, their kids go to school, they form part of a community, and they're part of San Diego. And that's where we are asking support of elected and community leaders' faith to stand with working families, because it really does affect the entire community structure. What we're seeing with our members is that they earn anywhere from $21,000 to less than $17,000 a year working full-time. They have very limited access to health insurance. Downtown buildings, the high-rises here, they do have family health insurance. That was one after a very difficult strike in 2000. But now janitors, even in downtown, they have to wait 2 years to qualify and have access to that medical coverage. The suburbs, the picture is a little different. Our members are earning around $17,000 a year full-time, can barely make ends meet, and most of them do not have access to health insurance. That's where the bulk of our members are at, and we only have a very limited group of members that have access to individual coverage. And that is because we've been working very hard to have a pool, and we have a trust fund, and that's what we can afford right now with what the contributions of the employers is, having 300 janitors covered with individual coverage in the suburbs. And what we've seen is that at the feet washing event that Rabbi Lori shared, there was a member that shared a story that all of her kids have asthma because they also live in communities that have a lot of environmental hazardous conditions. So a lot of our members their children have asthma. One of the stories, she had chronic asthma. Her daughter, who's probably like 5 or 6, she had chronic asthma and has been hospitalized many times. And she so happens to work at a medical institution and has no access to health insurance. And that's what we see day in and day out. So what we're bargaining for, and what we're asking these leading, these industry leaders in the biotech firms and in the commercial real estate is that it's time for San Diego to move forward. We have the lowest wages and the poorest benefits in the entire state. We're one of the most expensive cities. We have the most affordable health care in the entire state. And our members are still behind. So we're saying we want modest wage increases, but really it's time for San Diego to turn and for the janitors to have health insurance. As these same companies pay for it in other parts of the state, San Diego should not be left behind.
Including Orange County, right?
Orange County, Sacramento, San Jose, Los Angeles, every major city in the state has it, except for San Diego. And I think that's why we're here, and we are hoping to be able to have San Diego raise its voice and say San Diego should not be left behind again. And I'm going to turn now to Maria Aldama, who's one of our leaders, part of the bargaining committee as well, to share some words with you all.
Buenas tardes. Mi nombre es María Aldama, yo soy janitor y pues estoy representando a varios janitors en la mesa de negociaciones y realmente estamos pidiendo salarios dignos y aseguranza médica.
My name is Maria Aldama. I'm a janitor and I'm representing many of my fellow coworkers at the bargaining committee, and what we're asking for is health insurance and for a dignified wage.
Vemos personas que tenemos que tener 3 trabajos como para salir adelante, porque realmente con el salario que tenemos no nos alcanza.
Many of us have had to have up to 3 jobs to be able to make ends meet, because with our current income we cannot afford to live.
Y trabajamos para corporaciones muy ricas y realmente ellos no ven el trabajo que uno hace, el desvelo que uno tiene, amanece uno y con los hijos y realmente ellos no ven el trabajo que uno hace.
And the reality is that we're working for very wealthy companies, and they do not take into account the sacrifices that we do, being able to work every night, having no sleep, and having very limited time with our children, and they do not take into account the sacrifices that we have to make.
Y yo soy una de las personas que trabaja en Rancho Bernardo y habemos personas que no tenemos una aseguranza médica, y eso es lo que estamos peleando ahorita en las negociaciones, un salario digno y una aseguranza médica, porque lo merecemos.
I'm one of the janitors that works in Rancho Bernardo, and I do not have access to health insurance. Many of us do not have access to health insurance, and what we're asking for is to have access to insurance and dignified wages, because we do deserve them.
En Rancho Bernardo ganamos 9.10 la hora, y realmente ellos dicen que no lo merecemos, no merecemos más. Es una ofensa para ellos lo que nosotros estamos pidiendo.
When we say that we want health insurance, right now we're earning $9.10 an hour, and they took offense in saying that what we are asking for is too much and that we do not deserve it. This is a little history. So the first contract that was, and the first janitors that were organized were the downtown San Diego Janitors. So that was its own separate collective bargaining agreement, and through the strike of 2000, they were able to gain, because there were multiple strikes throughout the country at this time. I want to just keep that into context. Los Angeles went on strike, New York, I think Chicago went on strike as well. So as a result of that national campaign, the janitors in San Diego, with their strike, won family health insurance for downtown. The suburbs were largely unorganized. So we moved campaigns to organize the suburbs, and so they, in 2003, when they all became organized, and in 2005, the willingness of the industry to move towards the same direction, even with a strike, in the suburbs was not there. They kept on saying that the suburbs did not have the same type of clients or type of office space that downtown had. And the reality now is that the suburbs rental space and clients generate more wealth and income than downtown San Diego. So the county has changed throughout the last 10 years, where the majority of the office occupancy is no longer in downtown, it's actually moving to the suburbs, whereas in 2000, so it used to be 2 collective bargaining agreements. In 2008, we managed to merge them, but they have different zones. So you have Zone 1, which is downtown, and Zone 2, which is the UTC area, and then an outer Zone 3. And what the client sector keeps on coming back with has been that not each zone can absorb the same economic benefits. And of course, we're always challenging them, but what we've seen has been that we need an industry to move, and that's where we're at today. So the challenge of, the biggest challenge here is that Illumina, Amlin, Irvine Company, Genpro, all of these, they contract out their janitorial work. So who we're directly bargaining with is the janitorial contractors, who sit at the other side of the table. They're the direct employers. And the direct employers...
So you've got the janitorial contractors is who you're actually negotiating with, not Illumina.
Yes, that is correct. And why we focus on Illumina, for instance, which one of our bargaining committee members is a part, works at Illumina, or Irvine Company, is because ultimately Illumina and Irvine Company are the ones that make the decision of the budget that goes into janitorial services. So everywhere that we've seen, right now we're engaging major commercial real estate owners in the state, some of them which are part of the tech, some of them which are like the largest commercial real estate owners. We just had a meeting with Irvine Company, and we had a meeting with Blackstone, which is the largest statewide. And when these clients that actually furnish the money for the janitorial services for their contractors make the decision that we're going to move forward as an industry, that's when we see the industry as a whole move. Well, right now the problem isn't that the insurance is actually too expensive, because we've compared it to what they're paying in different parts of the state. And the health insurance for individual coverage is in the mid-200s. It's actually a very affordable plan, and it's a great plan. Our family health insurance is amongst the most affordable in the state. We have talked to different brokers, private. We've also talked to other trust funds and with the employers, and realized that we have some of, for the benefit that the members are getting, we have some of the best prices.
So I think you're talking apples and oranges. You're thinking an individual policy, and Sandra means just in the coverage is distinguished between full family health care in downtown, and for example in the suburbs, those who have health insurance, they have a group policy. It's only the individual, their children aren't covered and their spouses aren't covered. So that's what she said.
Even an additional cost?
No, it's not an additional, the additional cost, if you want to add your child, it ends up being more expensive than paying family.
Okay. Thank you.
So, and I wanted to say something, because you're right, biotech companies don't together make decisions, and the goal is not for them together to make decisions. Our experience is that, our experience over a large number of years from the faith community is that what do you tell your facilities manager if you are the executive in charge? And if you're the executive in charge of facilities, you're also not the CEO or president. You're somebody who's in charge of facilities. So your message is, do it the best you can for the least amount of money. You never actually take the time to think about, really, what does that mean to the lives of human beings? And so what we as community are able to do is we're able to access the presidents of corporations. We're able to access the decision makers and say, are you aware that the people who wash your toilets and the people who dust the pictures of your family vacation, or in the instance of the biotechs, or keep your clean rooms clean, or clean your operating rooms, are you aware that those people earn $17,000 and have no health care coverage, or very little health care coverage? And once the conversation gets to that level, it changes the conversation. But so, though the biotechs wouldn't move as they don't move as a collective, there is sort of a sense that in the biotechs, and I know that you're doing studies about that right now, in the biotechs that do care about the well-being of their own employees, very often they can be moved to understand that the janitors work for a contractor, and that's the way they want it. They're actually doing services that support are very persons. They are washing our toilets and vacuuming and emptying our trash. So there's not very much distance between us and them, and people get that. So for example, even the president, when there was a struggle at UCSD campus around the pay and the benefits of the service employees there, women who clean and provide food in hospitals or who clean dorms and things like that, the community and people of faith met with Mark Yudof. It wasn't just UCSD, it was all 10 campuses, and we met with Mark Yudof, the president of the system. And through that, the women who do exactly the same thing as the women who clean in the biotechs at UCSD have $14.50 an hour is what they're earning now. They have full family benefits, they have pension, they have a life that is completely different than the look of the life of the women who clean the buildings half a mile away. And so that's why it's so important to have community engaged, because there's access to a different kind of decision maker.
And just to show that there is hope, for instance, one of the largest biotech firms in San Diego, which is Genentech, they're leading the way. They're saying, yes, the janitors that clean my facility and all of the service workers that clean my facilities are gonna have a living wage. They are gonna have family health insurance, and they actually also have a pension. The only janitors in the entire county that have a pension. We've been engaging, we have different electives engaging the biotechs, we're engaging the biotechs. And at the very high levels, we do have them come back and say, we did not know that. We did not know, and some of them actually have policies because they are within the life science and medical research fields. They say, we did not know that. We actually have policies that everyone that works in our facilities should have access. All of our employees should have access. None of our employees wait 2 years to have access to health insurance. So they need to be aware, but they also need to know that the only ones that care about this are not just the janitors that clean the building at night, because that's when it becomes a very isolated issue, and that's what has kept San Diego behind the rest of the state. And when they see that when they see that communities that our members are a part of in the cities that they work in start taking an issue on it and say, well, it's great that you're providing a job and it's great that we're prospering, but let's grow our communities with you because you're gonna form an integral part of them. That's when we start seeing real change. And it's not gonna happen from one day to the next, but we could definitely take significant steps to move towards that direction.
So the only other thing I wanted to add that was relevant to you all is City Councilman Kevin Faulkner has also gotten quite involved in that. He is, has strong relationships with Irvine Company, that is the biggest building owner in San Diego, and he has insisted that Irvine Company meet with the janitors, meet with Sandra and the janitors, which they have done, and he's also insisted that he has reports back from the union and from the executives at Irvine Company about the progress of these conversations. So his voice so we have 3 actually super active city council members, and it is unusual for Councilman Faulkner to be so involved in the concerns about unions, and so we are very, very grateful to have his participation and thought you would want to know about it. Well, we would like you to talk about it and to engage to the fullest extent that you feel comfortable. We would like you to write a letter of support for the well-being of the janitors in terms of the need for every San Diegan, everybody working in our city, to have health care in whatever way that you would like to write it, and actually in a way that is conjunction with the way your city council people who are involved would like to see that. What would help them be strong? We would like to see you do that. We would also like to see the Human Relations Commission write to the biotechs, the leading biotechs, and the Irvine, Arden, and Kilroy property owners, suggesting that if they are able to provide the health insurance for janitors everywhere else in the state, that you as a commission expect to see them do so in San Diego as well, because there is no reason other than will that stops them from doing that. So, you know, to the intervention, to the extent that you would like, Sandra, how else do you see this?
We can definitely keep you all engaged, but that is the primary thing. They need to start hearing from the broader San Diego community that San Diego deserves what the rest of the state has. And that is the most pressing thing that you all can do. We'll keep you all engaged. We're going to be meeting, like Rabbi Laurie said, we're going to be following up with all of the city council members, and we're going to be having a public hearing on jobs in the month of May 11th. If any of you are interested, we'll send you all the invite. And the same principle, which is we have been compiling a significant amount of research showing the prosperity and the growth in San Diego in these leading industries. And there has been some job creation, and some of it which is really great, and we're going to applaud that. But we think we have more ways to go, especially with the lower wage jobs that have been created, not just the janitors, but there are other low wage workers there, and be able to hopefully move this county forward. We're going to be raising some serious concerns on health and safety that we've seen in a lot of these facilities, and working conditions, because it's not just about benefits and wages, but it's also the working conditions that our members face, like Rabbi said, at night. So we'll be sending you all this invite. This will be in May 11th, but I'm going to echo what Rabbi Laurie said. It's getting the word out there and saying San Diego matters, just as Orange County and Sacramento and San Jose, Oakland, San Francisco, and Los Angeles. And
one last thing. I think several years ago, some of you were aware that Center on Policy Initiatives did a study called the High Price of Low Wage Jobs. There is no question that people don't get less sick because they don't have health insurance. So people avail themselves of services and have to avail themselves of services. The emergency room is not the right place to handle an earache or a sore throat. And yet if you have no insurance, that's where you have to go. And school lunches for people who are earning a living. Nobody wants their children to have access to school, to Title I school food, unless if they want to earn a living to support their families. People want to be able to support themselves and their families in dignity. And so there are a lot of services that people who work in low-wage jobs avail themselves of that the taxpayer pays for. So although those workers are not getting health insurance, they are going to the emergency rooms of the hospitals in this city. And it is crucially important that we ask businesses to pay to pay their share and to pay their workers a way so that people can support themselves, not on public services. Not that we don't want to cut public services, because of course we want them to be available for those who need them. But we also want our corporations to be good corporate citizens. And part of that is not sending their workforce to emergency rooms for health care.
So do I hear a motion to have a good corporate responsible behavior sort of letter written? Do we have a motion by any of the commissioners? Commissioner Core. Do I have a second to that motion? Commissioner Slomanson. So let's can I have a vote, please? All those in favor of supporting a proper, responsible corporate behavior to engage the entire community of San Diego, where the suburbs, which are now, where the growth is of San Diego, to be included and be treated similarly situated to the downtown area. And that those people that are considered low income be given the right to health insurance for their families, based upon that they're part of this bargaining unit. We can clarify the details of the letter. The first letter will go out to the council and the mayor. The second letter will be sent out to designated corporations that we feel that are appropriately within the area or the venues that we're to negotiate with. All those in favor, please say aye.
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 All those opposed? Any abstentions?
I abstain.
Abstain. It will better the entire society and communities, and especially districts where the low-income people are living. They're going to be bringing funds back and spending them, not on health care, but running to the emergency room, but in the local store, the local shop, buying,
That's right.
and helping. Plus, it'll probably provide assistance to get them to the next level in society.